In preventing the systemic failures that led to Hope's death, I propose the following. When I talk about hope, I'm not just talking about my daughter. I'm talking about a generation that's been failed by every system that was supposed to protect them. Let's be real for a minute. What happened to Hope didn't start the night she passed. It started years before, in classrooms, in courtrooms, in doctors' offices, in systems that punished her pain instead of healing it. We can't fix what we refuse to face, so here's what needs to change. Number one, end the criminalization of addiction. Addiction is not a moral failure. It's a medical condition, but our system treats it like it's a crime. Hope didn't need handcuffs. She needed consistent, compassionate care. We need to divert people to treatment, not prison, and fund programs that address trauma, mental health, and recovery, not just detox. Detox is not recovery, it's a reset. Number two, accountability in probation and parole. Hope's probation officers expected her to fail before she even began. That's not justice, that's entrapment in despair. We must retrain these officers in trauma-informed practices, hold them accountable for bias, and ensure they are partners in rehabilitation, not overseers of relapse. Number three, integrated mental health and substance use treatment. Hope suffered from co-occurring disorders, depression, anxiety, PTSD, but was treated like she had to pick one to get help for. We need dual diagnosis programs that treat the whole person. No more waiting lists, no more you have to fail first before you qualify for help. Number four, family support systems. Families are drowning in fear and confusion. When your child struggles with addiction, you're handed judgment, not guidance. We need community-based family navigation centers, places that educate and walk alongside families so they don't have to fight the system alone. Number five, reform in the courts. Drug courts should not be revolving doors. Treatment should be integrated with it. For first-time offenders after successful completion, their records should be sealed, if not expunged. Hope's records should have been sealed after she completed her sentence, not something that followed her and blocked her from housing, jobs, and dignity. We need automatic expungement, and we need judges who understand addiction science, not just sentencing guidelines. Number six, trauma-informed education and prevention. By the time our kids are in crisis, it's already late. We need trauma education in schools so teachers recognize signs of mental distress and substance use early on. Every child should have access to a counselor who's trained in more than just academics, someone who can catch the quiet cries for help. Number seven, accountability for those who supply and exploit. Let's not forget there are people profiting off of pain. Dealers, traffickers, and even some corporations have blood on their hands. We must hold them accountable while still focusing on saving the lives of those they've ensnared. Number eight, we need to shift the language, change the stigma. Words matter. When we say junkie or they're just an addict, we strip people of their humanity. We need to start saying person with a substance use disorder or opioid use disorder. When we change the language, we change the way people are treated. My daughter isn't a statistics. She is a soul, and the systems that failed her will continue to fail thousands more if we don't demand better from our healers, from our communities, and from ourselves. We don't need another commission or another study or another moment of silence. We need reform, responsibility, and relentless compassion. Because until we address the heart, the why people use, the how they fall through the cracks, we'll keep losing our hopes. And that's something this country simply can't afford. I am Sandra. I am Hope's mom. And I am Hope's hope.